Well, welcome back. In today's Medical Monday, we speak with Bon Secours Tuckahoe Orthopedics. We're talking about advancements in knee replacements this morning. Joint replacement surgery isn't what it used to be, and thanks to advances in technology, joint replacements are longer lasting and feel more like natural joints than in the past. Recovery is also faster as well, and people can get back to their everyday lives sooner. Joining us to talk all about it is Dr. Colin Mudrick. He's an orthopedic surgeon at Bon Secours Tuckahoe Orthopedics. Thank you so much for being here today.
Yeah, thanks for having me, Macy.
And tell me a little bit about new advancements or techniques when it comes to these surgeries.
Yeah, so, knee replacement is one of the most successful operations that we do in the U.S. currently. That being said, if you've talked to anybody that has had a knee replacement, you know that it is no easy feat for recovery. The good news is there have been a couple of big advancements, at least in my opinion, in the last 5 years. And in our practice, number one is the addition of robotic surgery. Okay. And number two is a technique called a subvastus approach to the knee, which means that it is a complete muscle-sparing approach to knee replacement. So both of these techniques, the goal is to minimize tissue trauma when we do surgery, which translates to less pain and better outcomes. So if you look at the past 30 years, there's been very little change in knee replacement in what we have done. And essentially, we have been putting a knee in that is perpendicular or 90-degree angle to the ground. The problem is, if you look at our population, 1% of us actually has a knee that is perpendicular to the ground. So in my opinion, we've been kind of shooting for the wrong target for a long time. And not only have we been shooting for the wrong target, I think we have been using crude tools to do so. So we live in 2024 where we have ChatGPT, iPhone 17, smartwatches, and so you would think we'd be using technology to use when we're performing surgery on a human being. And so in my opinion, we're able to use this technology to minimize trauma to the knee when we do so.
Yeah, and I want to go back to something you said. Am I saying this right? Subvastus technique.
Yeah, so subvastus is sort of a medical speak, but what it means is that it's a complete muscle-sparing approach. I actually brought a little handy-dandy
model. We got a little something for you. Can we zoom in on here?
And so if you look at this model of the knee, traditionally when we do a knee replacement, the surgeon cuts around the kneecap and splits the quadricep tendon and muscle. So you can imagine that's a lot of pain to recover from. In a subvastus technique, it means that we actually come around this muscle, we preserve all four of the muscles and tendons, we do the surgery, and then we let it fall back into place. When we do that, I think we give our patients the best chance to start from day one to have a good outcome. And when we can do that, I think it makes their journey a little more pleasant than it would be otherwise.
Now, how can you determine if a patient is a good candidate for this type of technique?
Yeah, so the good news is that there's certainly a learning curve to learn this technique, but now in our practice, 80 to 90% of the patients we do surgery on are good candidates for a subvastus technique, and 100% are good candidates for robotic surgery.
Okay, interesting. And what does the recovery process look like for the subvastus technique as opposed to, just undergoing the knee replacement surgery?
Yeah, so I think an easy way to look at it is looking at how long patients use a cane and or a walker. So traditionally, with a traditional approach for a knee, patients will be on a cane or a walker for 3 to 6 weeks sometimes. With this technique, when you're not cutting through muscle or tendon, it makes sense that those patients are going to feel better early on. So we have seen a big reduction in the time off of a cane and a walker. And in some cases, we've had patients in 3 to 5 days off of a cane, which is pretty amazing.
That is really good. Is there anything else people at home should know about any of this?
Yeah, I think that, again, sometimes I feel like with technology we're drinking from a fire hydrant, so there's a lot coming at you. And so I think really it comes down to having a conversation with your surgeon, knowing when knee replacement is right for you, and then knowing how you would like to proceed to get your life back.
And where can people find more information about all of this?
So we are at Tuckahoe Orthopedics at Bon Secours Mercy. I have my own website, which is colinmudrickmd.com, which also has a lot of this information that's available.
Awesome. Dr. Mudrick, thank you so much for being here today.
Yeah, thank you so much, Macy.